It seems that there could be an extension of the lockdown. At least that is what the state chief ministers have asked and requested the Prime Minister to consider. We don't know whether this is official yet or not, but it seems that that's the right way to go, right?
Yeah, I really think that, given the rising cases of positive tested, people, I think obviously most state governments are seeing certain, parts of their own sort of urban centers also being considered hotspots and things like that. I think we should err on the side of caution, and I think a 2-week extension allows us to be in a better state of preparedness. And we've seen what the lockdown has done for the country in the first 21 days. Certainly, it has put us into a much safer kind of an area compared to many other countries. So I think another 2-week extension actually allows us to be even more prepared. Having said that, of course, just as the previous speaker said, I think there are some concerns about, the fact that this is harvest time, the fact that we do need agriculture to, go on because we don't want to lose crops in the field. And I think there are, ways of actually ensuring that certain parts of the economy are allowed to continue based on the threat levels. I think every state government has done a heat map in terms of red, amber, and green. And I think many of the green zones are in rural India. And I think these agricultural belts may be allowed to continue. And in fact, these are sort of green zones which need to be sealed off from ingress from the red and orange zones. So I think these are the kind of measures that many state governments are taking. I think the red zones have to be absolutely sealed off with no ingress or egress. I think green zones should be sealed off from ingress, and I think even the amber zones can have a partial lifting. Today, as you know, a lot of the essential services are being allowed. Many essential industries are also being allowed to operate. So I think that will continue for the next 2 weeks. But I think the government would do the right thing by extending the lockdown.
Yeah, it seems to be the case. And if there is any hint in Chief Minister Kejriwal's, tweet, he's pretty much spelt it out, saying that, the Prime Minister has taken the correct decision to extend the lockdown. He's saying today India's position is better than many developed countries because we started lockdown early. If it is stopped now, all gains would be lost. To consolidate, it is important to extend it. But I'm sure we'll hear an official statement from the Prime Minister's office shortly. But, Kiran, on the other thing, containment is one thing and testing is the other. And, since you're the right person to really talk about that, wanted to really understand as to what really is happening on ground, whether there are more and more tests being conducted or not. Because, a lot of people are now saying that India has been able to sort of contain the numbers because we're not testing enough.
The fact that we need to test more, and I think it is happening because the numbers are slowly ramping up. As you know, we are now at around 14,000, 15,000 tests per day. And as you know, this number needs to ramp up to 100,000 tests a day. I think if you look at what the private sector brought in less than a week, it was 16,000 tests altogether. But I do believe that the private sector is capable of basically providing a large number of tests on a daily basis. And I think this is definitely very important because we need to increase the denominator to ensure that the statistics that we are seeing today of the proportion of fatality, the seriousness of or the severity of the disease can only be ascertained if you have a large number of patients who test positive. And when you start looking at the percentage of two things, one is the number of people tested and the percentage of positive patients. That's a very important metric. And the second thing is how many of the positive patients are turning into severely affected patients and how many of them are actually dying. I think these kind of statistics are going to be extremely important for us to know how much in control of the disease we are.
Yeah. Since we're on the subject of testing more, Kiran, I mean, it's still a very fluid situation. We don't know what's really going to come out of it. But there seems to be a lot of, friction with the Supreme Court saying that private labs should make the tests free of cost. And obviously, private labs are saying, either we charge the customers or the patients in this case, or we get money from the government. They can't go free throughout the process.
Well, there are so many factors to this. It's very, very difficult to have a sensible, discussion. On one hand, I do believe that people do need free tests because it is a public good, public emergency. And whenever there is a public health emergency, it is the government's responsibility to provide free tests. On the other hand, we also realize that the cost of the tests are quite expensive, and obviously we don't expect the labs to give it free of cost. On the other hand, why can't we get the kit manufacturers to lower their costs? Why can't we get insurance companies to pick up the tab? Why can't we get government to pick up the tab for a certain part of the population? How are we going to who are we going to test? How are we going to test? What are the numbers we are looking at? I think we need to do a proper assessment of what it's going to cost us. Because today we are shooting in the dark. We are just going on making statements about how people have to be, come to the fore and rise to the challenge. All that is very well. But, the private labs are struggling. They are not able to test at the levels that you want them to free of cost. Certainly they will be very willing to offer a few tests free, but to expect them to, offer free testing for such large numbers that we require is absolutely unreasonable. So I think, we should become a bit more, understanding and a more sensible approach in terms of how the government is going to support testing. I think that is going to be very key. And the insurance companies too need to be roped in for this. I think kit manufacturers have to be told to lower their costs, because if the kit costs come down, automatically the testing costs will also come down. Right now, the testing costs are directly linked with the cost of the kits. And initially, the kits were all being imported. Today, the indigenous kits have to be much cheaper. They are not at the moment. So I think these are some of the things we have to understand and discuss. And when we ask the indigenous kit manufacturers why they can't make it cheaper, they say that many of the components are imported, and with the depreciated rupee, they haven't even factored in that part of the inflated cost. So I think there are lots of factors that we need to consider, but I, for one, believe that there is a very easy way of solving these problems. Let's put the kit manufacturers, the test providers, and the government together, and let's find a way out. But for the Supreme Court to take a unilateral decision without factoring all these dynamics, I think was very unreasonable.
Yeah. Yeah, I mean, there are just so many moving parts, like you rightly tried to highlight. I mean, it's a bit of a catch-22 situation on both ends. But on the economy, Kiran, and time and time again, we talk about the economic impact, not just for India, but for the entire world. Do you think the time has come, or, have we sort of crossed the bridge now? It's high time that the government announces that stimulus package, because India Inc. really is going to be suffering. I mean, I know in the pyramid it is the, it's the bottom-up approach really that any government would sort of undertake, and we know what happened in phase one, but now they need to extend that helping hand to even India Inc.
The way we have to approach is to see how many jobs we can save, how many jobs need to be supported, and how many jobs can be created through stimulus. I think that's the way we really need to look at it, because right now it's about really making sure that people have livelihoods, people have jobs. And if you look at the way the government has gone about it, yes, absolutely correct that the first stimulus had to be given to those who are going to lose their daily wages and their livelihoods and the poorest of poor. But now I think we do need to look at labor-intensive industry. We need to look at the small and medium industry and those who are really employing large numbers. And as far as the large companies are concerned, I think we have to make sure that they continue to be supported for the employment that they have created. And we want to make sure that people don't shed jobs, people don't lay off people. And I think investments or stimulus have to be job linked. I think that's my view of things, because that's the way you can actually at least keep people employed, and at least in some way the consumption and wheels of the economy moving.